Good morning. I'm Rosemarie Halt from Maternity Care Coalition. I'm the Director of Policy for Maternity Care Coalition. So just wanted to kind of really add and enrich some of the conversation we had already today, which has been wonderful. Maternity care was born in 1980, and primarily because the infant mortality rate in Philadelphia was higher than most third world countries. So we've been working on that for a long time. This is Tammy. She was one of our clients, and I wanted to just give you a little overview of Tammy's story because I think it really frames what we're trying to talk about today. But one of the things I have up here is you are meeting me on the page of the many chapters of my life. That was really a telling moment for me when one of our clients, not Tammy, told me this. She was suffering from substance use disorder and had a long traumatic history in her life. And it's, I got her on a bad day, and she really told me, she's like, you are judging me on this day, and yet you don't know the 10 chapters of my life. And she goes, and I know I have many more chapters that are ahead of me. And I think that's really important to frame a lot of the things when we're talking about poverty. Because it's really easy to say you should be working harder, you should be doing this, but there's a lot of factors that enter into why people end up in poverty. So Tammy came to our program. She was 18 years of age. She was pregnant with her second child. She suffered a long history of trauma and sexual abuse. She was being currently abused by her partner who she was pregnant, so she left that partner. But she was also suffering a lot of depression and anxiety. She was not making her prenatal appointments. She was almost kind of giving up. And so Tammy, through the work of what we call our advocates, which are our community health workers, was able to start on the path. We got her going to her prenatal appointments. We started helping her find housing. That key thing that we hear is housing. We helped her finish her GED so that she could, start on the path of looking for work. We helped her navigate, which is really, really hard, the healthcare system. I tell people, that's like our healthcare system is so difficult right now, and if you have a complex history, so if you're a pregnant woman and you have, mental health issues and you have a chronic medical condition, which was the three things that Tammy had, think about all those doctor's appointments. And then think of going into a big healthcare system and you're bringing a toddler with you and you're pregnant and it's a pouring rainy day and you're expected to be in this building for 5 hours and you can't get childcare because you're not working so there's many barriers beyond just like the income parts of this. It's a lot of things that get in the way of people moving forward. But Tammy persevered with the help of her advocate, and she continues. When her son was born, did have some issues that required early intervention services, so we were able to connect to early intervention services. We were able to help her get a part-time job, and she's continuing to really be a great mom. She's so happy now, and she feels like she's empowered to do what she needs to do to take care of her family. But all of us at one point in our life need help, and it's just having. Luckily her pediatrician was the one that referred her to our services, but luckily somebody in her life intervened and pointed her in that direction to get help. And there's so many great community-based organizations trying the same things here, so I don't want to say it's just us, but there's lots of ways, but it's sometimes making sure that person's getting the right help at the right time. And that's, I think, where the barrier happens in many counties, to be honest. So some counties are now looking at like centralized intake, which is and I call it the no wrong door, right? So if you show up at a county services office, somebody shouldn't give you a list of 10 people to call, because you're probably having depression and anxiety and a lot of other things happening in your life, and somebody handing you a list and say, call these 10 numbers and maybe one of these people can help you is not going to get the person to the right place. But having that person at that time say, hey, let me go through and let's help you figure out which is the way, and let me make that call for you while you're sitting in front of me is a much better way of making sure people are getting the services that they need. So just a little bit about NCC. We have like 5,000 families that we serve annually. We're in 4 counties. We have 20 different programs that we do. Our most intervention-based ones are Healthy Families America and Early Head Start, which are really intensive evidence-based home visiting programs. But we also do a lot of things like childbirth and doula. I brought papers with the 6 programs that we actually do in Bucks County, so I can leave that somewhere in the back there.
Over here.
But the interesting thing about Maternity Care Coalition is we always try to meet the mom where she's at. So if mom needs just a crib and a little safe sleep education, that's great. Some people really need intensive help like Tammy, and they need to be in our program for 2 or 3 years to make sure they're right on the path, that they're taking care of her and baby and all that. And then there's lots of stuff in between. So we try to fit our programs to the parent, not the other way around, which sometimes is the tricky part. And we also are right now and I think this is a really important point, and it was touched on a little bit, how the opioid epidemic has impacted poverty, and we'll have a huge 2 generations being the new epidemic. I could talk the whole day on that subject alone, but just want to let you know, and it kind of brings me up to this. So there's really a roller coaster of current political and policy landscape out there. So many things are impacting poverty, and I think we have to be realistic about some of these. And housing continuously comes up on this list, workplace taxation, all these things overlap in what we're trying to do around fixing poverty. And we're entering a political landscape of the 2020 elections, and I think it's really important that this issue of poverty becomes, especially for women, because women and families who are living in poverty right now are going to be the major reason why America is not great anymore. It's like, but it's really that we have failed to address that issue for a long, long time. Maternity Care Coalition, we are standing behind what we are saying. 3 years ago, we increased all our entry-level positions to $15 minimum wage, living wage. And I'm not gonna lie to you, it wasn't easy. And we've had to do a lot of extra fundraising, and but we felt it was really important because many of our community health workers, who we call advocates, actually come from the communities that we serve, and many have actually been former clients. And so we can't really stand up and say, we are supporting you guys, but we can't pay you because we're a nonprofit. I mean, that, is just not the way to move the bar forward. So it's not been easy. Our board has many long nights trying to figure out how to keep the ship afloat, but we try. So I think, I really, again, applaud all the advocacy you guys do. I enjoy working with you a lot. I think there's a lot to be happening in Pennsylvania, particularly this year, so I hope that we're successful.
Thank you.